Okay, Doc.
Welcome back, Dr. Hamna. Now we will talk about study skills.
All right. Thank you, Dr. Sami. So the second important thing that we notice when we come to effective study methods is figuring out what study skills work for you. You need to understand that no two medical students, their way of studying, their approach to a topic, a subject, no two students have it alike. Some of us like it in forms of repetition. Some people, they like doing it once and then they like understanding what it is and moving on because they find repetition, they don't like it. But what's important is you figure out what study method works for you. Are you better off studying, for example, say notes? Or are you better off studying from a PPT that a lecturer has given? Are you better off studying a book, one of the resource books that a university recommends? What is your form of, what is the maximum input that you get? Are you a visual person? Do you like to see more? So you need to understand that quite at the start of it, and you need to figure it out quite quickly as well. So if you are somebody who likes, who needs the concept to be drawn out and explained in details, and you need, the extra push, I can say, then you must find out what resources are the best. Right now, the resources actually in the field of medicine for education is flooding. We have so many resources. We have Osmosis, we have Voids and Beyonds, we have all of these wonderful websites, Online MedEd, Lecturio. We have so many right now that they're hard to keep track of. But you need to figure out which one suits you best, and you need to figure out so it's easy for you. So you know exactly when you need to study a topic. Let's say I'm starting physiology. Let's say I'm starting cardiac physiology. Cardiac physiology is quite hard and it requires a lot of understanding. So instead of figuring out how am I going to understand this and struggling a bit and this and that, it's way more easier if you know exactly what you're going to do. You attend a lecture and you know that this topic is quite challenging for you and you wouldn't understand it on your own. Use a secondary resource. Use a video. Boards and Beyond, Online MedEd are some of my favorite ones. But you can use anything that suits for you. So use some form of video reference, and now we have references that are up to like 2 minutes, 3 minutes. Some of them are 10 minutes, 20 minutes. So depending on how much help you need in the topic, you can always find the help for the topic. Something that we're at Al Faisal that we're very glad to be that I'm very happy to be part of is the Academic Success Center. If a student finds a topic particularly hard, all they do is that they book an appointment with one of the consultants and they ask the consultant to explain it to them. And us as senior students, all we have to do is revise the topic and then we explain it to them in such a manner that they understand it way more easily. I understand that this might not be available to all students, and also all students might not be able to set up a time that is suitable for them to come and have this kind of access. However, that's what I'm saying. You can have any form of help. It can be a 2-minute video to a half-an-hour video, depending on how much extra help you need in that topic. What this does is that it makes you understand the topic in such a manner that you're thorough with it. Reading a paragraph 15 times will not help you if you don't know what exactly the paragraph means. But if you understand it in the first go, then you're far more better off with it. The study under study skills. Second thing I would say is about how much can you take in one go. So, for example, my focus is 1 hour. If I sit and study for more than 1 hour, then I'm losing focus, and I know that. So I need to take a break, a 5-minute scroll or a 10-minute video break, or grab a snack or coffee, something. So you need to understand what is your span, like how much are you able to fit in. It can start as less as 30 minutes. Your attention span can be 30 minutes. I have friends right now at the end of medical school whose attention span are 4 or 5 hours. They've built it up over a series of years. It's not like they entered med school with 4 to 5 hours of attention span. So it's very crucial you know what your attention span is and how much you can put in. A classical example for this is a lot of med students, a lot of students in general, follow the Pomodoro teaching, the learning technique, where they do a 25 minutes and a 5-minute break, and then a 25-minute, 5-minute break, 25 minute, 5 minute, and then in the end they take like after 4 cycles they take like a 15-minute break. So this keeps them refreshed throughout. So if something like that works, you can access something like that as well. And know your resources. Know your resources. This is so important, and I keep saying it because this was something I personally struggled with, because I would try to know as much as I can from something, but I wasn't making sure that this is what I need to know. So for as a first year, I was trying to, for example, if the topic was of cardiac physiology, I personally was trying to figure out everything on cardiac physiology, but I was missing out the basics. I was going into pathology, I was figuring out what's wrong in the heart, this, that, diving into the details, but I was missing out pure basics. This was because my resources were not sorted out. So when I started sorting out my resources and I figured out this is where I take this from, this is where I study this from. If it's pathology, I refer to a website, specific for pathology, like Pathoma. This is where I go through. This is the format I go through. Then that's when things started becoming way more easy for me. So master your study skills. Know what suits you. Know what's the best thing for you. This is what I would highly recommend. And figure it out early on. It's not a trial and error method. It's more of understanding what you need. If you need somebody to explain it to you, go through a video. If you need to read something to understand, go through notes or your recommended reference book. So understand what you need at this point. And med schools have excessive exams. I wouldn't say excessive, they have quite the right amount of exams, but these exams help in judging what you're studying. Like, these give a good analysis of what you're studying. Is it correct? Do you need to change something? Is this working or not? So you can take up these opportunities. And Al Faisal itself, you have all through year one, you have TBLs where it's every week. So you're pretty much giving a small quiz every week. So in these tests, you know exactly if what you did and the study skills that you used, were they effective or not. So I would say it's very, very important to master the study skills. And that brings us to the end of the second point.
All right, so we'll stop here, Doctor, and then we'll continue in the next session. Thank you.
Anytime, Doctor.